You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. Greetings, everyone, and thank you for joining me on this episode. I've got my special guest waiting here with me. So if you're watching the video, we're sitting here smiling. For those of you listening, my name is Dr. Charlotte Huntley, and I'm your host. I'm a public health entrepreneur with over 25 years of experience in healthcare and public health. And I've supported a lot of entrepreneurs along the way. On this episode, I'm going to introduce you in just a moment to our guest. And she's going to share about her business. And she's also a member of our mastermind program that I talked to you about so much on this podcast. At publichealthentrepreneurs.com, you can find out all about it. So just make a note of that. But for right now, let's introduce my guest, Jessi Hekmati. Jessi, welcome to the podcast. How are you?
Thank you so much for having me. I'm happy to be here.
Oh, I'm really happy that we were able to line up the times and you're able to join me. I'm looking forward to our conversation. Well, let's just start at the very beginning. Why don't you tell everyone a bit about yourself, about your business? Start wherever you like.
Yeah, so I started the public health journey actually during COVID, before the pandemic became a pandemic.
Okay.
So it was really interesting to follow along in my coursework as COVID unraveled. And yeah, it was quite everyone knew what an epidemiologist was finally,
right.
And all of the things. But so that was very interesting. And then I ended up having my second born. And so I took a year off and then I finished with my practicum experience where I kind of specialized. Well, I was introduced to the world of One Health, and that's where I specialized in my practicum and how I've started, what I'm doing today. So yeah, I just love all things public health and prevention and just how to benefit society as a whole when it comes to healthcare.
Yeah. So. I remember, well, not exactly the first time I was introduced to One Health, but I remember the feeling was almost like a light bulb that, oh, well, of course this makes sense. I used to work in virology. So when I was back in my microbiology days in healthcare, I was in hospital labs and specialized in the microbiology lab. And then I transitioned to public health labs first before doing other stuff in public health. And once I got there, I specialized in virology. And I'm not sure how I kind of turned and went down that hallway, but it was this specialized, and I found myself doing things like rabies testing.
Yes.
And running the tests for West Nile virus. I remember being in biological safety level 3, with all the gear and grinding these little mosquitoes, going, how did I get here? Why am I working with mosquitoes?
Yeah. How is this related?
Yeah.
Exactly.
So it makes sense to me. One Health just makes sense.
Mm-hmm.
So tell me a bit more about what you do in your business.
So, as I don't know how many people are aware of One Health and the whole side of basically how health is interconnected between animals, humans, and our shared environment. But basically, my business is centered around that. And Small Ruminant Solutions is my business. And small ruminants, they are sheep and goats, which are really a big industry in the U.S. Goats is becoming an even bigger industry. It's catching up to the sheep industry. And there's so many diseases that are transferred from goats to sheep to goats, and from these small ruminants to humans. And as you know, those are zoonotic diseases. Basically, the goal of my company is to educate people in the agriculture community, farmers, associations. It can be large, small scale farms, anything of that sort, and educate them on what zoonotic diseases are. There's over 60% of diseases that can be transferred from animals to humans and vice versa. So many of the infectious diseases that we see in humans, they can originate from an animal. People are aware of this, but there's quite a few people who are really unaware of just how contagious it can be from an animal to a human. So with One Health in my company, in Small Ruminant Solutions, not only do we educate people in this community, but we also can go in and assess the current biosecurity plan that they may have, if any. That could include quarantine practices that you do before you enter a goat pen or a sheep pen, and reportability. So the USDA requires a certain amount of reportability when there is a zoonotic disease. There's over 100 diseases that should be reported to the USDA for land animals. And that all helps that communication between the animal and the human world. So not only do we educate, we raise awareness just by letting people know that these diseases are out there and not to be scared of them, but to take proper precautions.
So my brain is kind of flowing here. So you see me scribbling, right? I'm getting a lot of ideas, extra ideas. It's been a little while since we've had a catch up. So this is like for me getting updated at the same time.
Yeah, exactly.
So this is great. I love to hear that. Great, important work and so many needs. I'm just curious, based on something you just said, do you find that there are a lot of maybe farmers that don't have a plan?
Exactly. There's so many farmers that don't have an actual biosecurity plan. It's very common for farmers not to have that. And even when it comes to importing animals, so it's very common for farmers and livestock, people who own livestock, to go and get these livestock at auctions. And that is a big issue when you bring in, let's say, a goat or a sheep or however many, you bring it into your farm. And they'll bring it in and it'll be in with all of their already existing sheep and goats. Then sure enough, 2 weeks later, they see an outbreak of something.
Yeah.
So that's another thing, is the preventative side of things. Like, how long should you quarantine them before? Do you have a quarantine pen? Do you have all of these steps set up? Yeah, to minimize that disease spread.
Yeah. I just see so many opportunities.
Yes, I know.
I am curious. So you started you said right at the early part of the pandemic. When did you first become interested in public health as a career?
Well, back in the day, I wanted to get into veterinary school, and then life had other plans. I had my first son, and, obviously I put that on the back burner, and I came across in my undergrad, I loved epidemiology. I loved my epidemiology courses, and I thought that would be a really good way to kind of fulfill the scientific side of me, but then also be able to get in and build off of my undergrad, which is in health promotion. So I thought that would be a good way to not settle, but a good niche for me. And then that's when I learned even more about One Health. And so the whole animal loving side of me, that made it even more exciting for me. And I just feel so fulfilled. Not only do I love this health scientific side of it, but I also get that animal passion fulfilled in this way, which makes me so grateful. And so that's kind of how I came across where I was like, I felt satisfied when I found this whole One Health niche and how I can help humans and people with disease prevention and all of that. That was my niche. And I felt it instantly. So during my practicum experience where I worked with Dr. Willie Lanier in Utah, he's the veterinary epidemiologist for the state of Utah. That's where he had me work in Q fever. So I studied Q fever in animals, in cows, sheep, goats, and then also in humans. And so I was able to work with the veterinarians and the Utah state, and kind of correlate the data from the human side and the animal side and find out where the gaps were, where the trends that they were seeing Q fever, how common Q fever was in the animals during certain times of year versus humans and all of that, which I was like, okay, this is what I want to do. Something in this. So
that sounds great. Not a lot of people kind of find that sweet spot where this is something I'm good at, this fits my life, I'm passionate about this, and it, where it comes together. So when I come across and I meet people that do have that or find that, it's great, because now that, for me, I feel like that's the thing that keeps us going, and we can recenter based on that. It's when the workplace gets crazy, when business gets crazy, then we can still kind of recenter based on that core passion, like the why. Why are we here? Why are we doing
exactly
that? Right. That's great. So thinking about previous experiences before you decided to come down this road of entrepreneurship, how do you think your previous experiences help prepare you for consulting and entrepreneurship?
I feel like I have a background in healthcare. So I have over 10 years of working in the cancer registry. So in data, submitting data to the state, all of that. And that kind of was another inspiration of what I wanted to build on. Like, what happens after the data is submitted? What's the next step? And rather than being on that bottom where I'm submitting the data and putting together the story, I wanted to do the next part and analyze that. So I feel like knowing where data comes from the beginning, even though it wasn't necessarily in the One Health field that I'm passionate about, I really get to see where data comes from. After a patient walks into the hospital and they're diagnosed with cancer, for instance, what happens then? And then how that gets to the different levels of data and how the data then is shared with the public and how they draw conclusions as to, for instance, why does smoking cause lung cancer? So basically seeing it from the beginning. And I feel like that really helps, especially the way my brain works. I have to start from a very basics and build upon it. And so I'm kind of able to see how it all gets put together. And I feel like that has really helped me with public health and this whole epidemiological aspect of it. So I'm able to kind of know from the get-go what you have to do to be able to then analyze and draw those conclusions in the field.
Yeah, that makes a lot of sense.
Mm-hmm.
I am kind of similar, just kind of understanding the big picture, the why helps me kind of think through whatever comes up if I have to understand the kind of big picture of things. So that's really, I can relate to that.
Mm-hmm.
I'm going to ask you 2 questions, but you can, because I like to present not just the pretty, this is the perfect world, become a consultant or an entrepreneur.
Yeah.
But kind of but I don't want to just kind of bash on it either. But I would just like to know, I'd like for you to share, what do you like most about consulting and entrepreneurship? And then what do you like least about consulting and entrepreneurship?
Well, let's start with the good.
Okay.
I feel like, everything's in what you dream it can be, you can make happen. And the creativity side of it, I've enjoyed that. The endless opportunities that your mind is just constantly going and you can do this and that. It's very exciting. It fulfills that side of me that's like the go-getter and the excitement that I want in life, really. I have I get so excited about things and I need something to satisfy that. This whole side of entrepreneurship is what does. And then, like I said, to the creativity side, the trying this, seeing if it works. If it doesn't, try this. The possibility to fail without having your boss or someone telling you that you did it wrong. You kind of just get to figure it out yourself. But at the same time, I feel like that's also what's difficult about it. The uncertainty that I love is also what makes it difficult. I have a full-time job on the side currently, or my full-time job, and I'm doing this, like I'm building this as I continue to work in my full-time job. And even though my full-time job provides me the security that I need, it's not fulfilling that passionate side that I want. So I feel like it's kind of what I love about it is also what makes it difficult.
Yeah.
The unknown.
Perfect. I definitely get it. And I was the same. I was working full-time job and I had started this podcast and then it led to like coaching and it was very fulfilling and very exciting. It filled a gap because my job was my job and it was good. There's nothing there's nothing bad about it. But I always had a feeling that I had more to give than I was allowed to in that role.
Yeah.
It's kind of the feeling I had.
Like constrained almost, huh?
Yeah. Yeah.
Yeah.
And so I was just open to how it would grow. I was just open. I couldn't even imagine really when I started that I would be doing this full time, but I was just kind of open to growing and seeing where it would go.
Yeah.
So this is very much like you described, like it's exciting and this is very rewarding. And it's also very, very much the thing that clips me up because it's like, oh gosh, I've got to figure that out.
Yeah, exactly. Yeah.
So I'm loving this conversation so much. And as we kind of wrap up, I have a question that I like asking this question because I think it kind of gives an opportunity to kind of tie it all together. I think as entrepreneurs, that's very creative all by itself. And, as public health folks, we're more scientific and maybe structured.
Yeah.
So the two together gives us the opportunity to be both scientific and creative. So in what ways are you maybe creatively advancing public health through your business?
I feel like One Health I feel like it's still very unknown. It's been around for a while, this idea and this concept, but lots of people still don't really know what it is. And I feel like my business is kind of bringing the awareness of that and the importance of the interconnectedness of health of, human, animals, and the environment. So I feel like it's bringing awareness in the world of public health, what One Health is. Think of how more and more animals are becoming a part of our everyday lives, which just makes it that much more complicated. The avian flu pandemic that's happening in the US, COVID, Q fever, any type of disease outbreak typically is related to animals because of how much they are a part of our life. So I feel like with my company, a big part of it is just raising awareness of the One Health initiative in the field of public health. It's also providing education. Not very many farmers and individuals know that, we need to report these diseases. How can we get these individuals to report the diseases so we know and we can nip something in the bud before it becomes a huge outbreak? So education. And also I feel like the biggest part of my company is bringing prevention. So what is the famous saying? An ounce of prevention is worth a pound of cure, which is my favorite. I love that quote. And I feel like with any type of later when we see this outbreak occurred, everyone looks back and says, okay, how could that have been prevented? And awareness, education, making it available to people in a way that they can be receptive is the best thing we can do, is create that prevention and raise that awareness. And so I feel like that's the ultimate goal in my company, is the whole aspect of prevention, which obviously we as public health entrepreneurs, we all know how important prevention is, whether it's a vaccine, whether it's education, biosecurity practices, just preventing those future outbreaks before they cause financial loss, lives lost, etc.
Yeah, that's really well said. Thank you for sharing that. And thank you for being my guest on this episode. This has been such a fun conversation. I've been taking a lot of notes. So I'm so glad that you're in the mastermind program so that I can use some of that time to dive in. Yeah. Oh, yeah. Glad you do.
I love it. The accountability I need,
Yeah. Yeah. I love how when we first talked, you applied and we met and talked. I knew you'd be a great fit. And I was really excited. Personally, we have a very diverse group in there, and I'm really proud of that. And I knew you were such a great fit, like your One Health perspective in there. And there wasn't any other person in the group with One Health focus. Not that it had to be something separate, but I knew that that would just be a great addition. So I'm just really thrilled to work with you. And now I've got all these extra notes. So I'm going to feed some of this back to you a little later.
Yay, I'm so glad. I thank you so much for everything. And you've just been obviously as a public health now entrepreneur, but we don't go into public health thinking like, oh, I'm going to have my own business. We're passionate about it and we need that guide. And I feel like you really have been that light for me, and I'm so grateful.
Aww.
I wanted to add one little thing because I just find it really interesting and serendipitous so my professor / head of my school, Regis College that I went to, Dr. Beatty. It's really interesting because Dr. Beatty and you guys are friends, correct?
Yes.
You guys know, I don't know how long you've known each other and all of that, but I just remember listening to your podcast and Dr. Beatty was a guest.
Oh, yes.
In your public health on call. I think
it's public health epidemiology conversations.
Yeah, epidemiology conversations.
Yes.
And so I put two and two together, and it just obviously, so I trusted you from the get-go, and like it just all came together, and Dr. Beatty recommended you, and it just really worked out. So I'm so grateful.
Oh, I absolutely love that. I'm glad that you added that too, because I've forgotten about that connection.
Yeah.
And that also, you just dated yourself. If you listen to the public health epidemiology conversations and you heard that episode, because he was one of the early guests on the podcast.
I mean, I've been listening since COVID, so
Oh yeah.
to older ones.
He is a great friend. We've known each other for a long time, and I'm trying to remember. I honestly can't remember when we first became friends, but I've known him for a very long time. He lives in my local area. So like he and his wife, me and my husband, we've gone out to dinner, we've spent time together. So that kind of a friend. And then I haven't talked to him in a very long time. So we'll have to make sure he listens to this episode.
Exactly. I'll text it to him when it comes out.
Like, that's right.
Wait, go to the end where I mention you.
That's right. But that's such a great reminder of the power of our network as well. And, really, getting to know people and when we maybe people are listening now are thinking, oh, this is great. They may go back and listen to that old episode with him. But just, just as a reminder, it's important that we are connected. When you hear someone and something resonates with you about that person, connect with them and just stay in touch. And you never know when things will, what we merge and what will come of it. But thank you for sharing that.
I'm glad that we had time to. I love that.
Well, thank you so much, Jessi. It's been such a delight to have you on this episode, and it's such a pleasure to work with you. And I'm excited to see and watch your business grow and the impact that you'll be able to have.
Thank you so, so much. I'm so excited. Thank you, Dr. Hekmati.
Thank you for listening. Visit publichealthentrepreneurs.com to learn more.